thank you to the committee for this opportunity to be able to present today. I want to commend the committee for centering the voices of lived experience in terms of the expertise of designing some of the solutions and responding to the housing crisis. I approach this testimony as a physician who has predominantly worked with unhoused patients over the past 10 years. I'm the executive director of the Gattuso Center for Social Medicine and as a researcher at the Dalla Lana School of Public Health at the University of Toronto. My thesis and the thesis that I believe that we have all shared and heard today is that we need to have a more expansive view of the housing crisis as really an economic, social, and health crisis. And when we are making the argument for housing as a health crisis, I would like to point to some of the data that I believe is incredibly damning for us as a country and one of the leading OECD countries when we know that people who are chronically unhoused live half as long as the general public. That is 20 to 30 to 40 birthdays and birth years that are lost. And if there was any drug that would be able to restore 10 to 20 life years, you would think that all funders would be tripping over themselves to ensure that these solutions and treatments could reach more people. We also know that for people who are unhoused, they are likely to be in hospital twice as long on average for 15 to 16 days. We also know that for people who are chronically unhoused, the healthcare costs are 7 to 8-fold according to CIHI data that was just released last year. The moral failure, though, I believe that was just recently published by Toronto Public Health is that for women who are chronically unhoused in the city of Toronto, the average life expectancy is 36 years old. And so this is why that myself and colleagues as health workers and frontline workers have been calling homelessness the most powerful social determinant of health, or really a thief of life years and productivity and health and well-being in this country. I do not believe there is more of a powerful testimony than hearing from Mr. Miles, but I think it underscores the view that this is not about individual failures. These have been policy decisions. And when we see more recently that there has been a real reduction over the last 20 to 30 years in the availability of social housing, now at less than 4%, I urge the committee to read the Scotiabank report of the public housing dividend calling for a doubling in the social housing supply in Canada, when we've heard again that the wait list to access social housing in Toronto, where I work, is 8 to 10 years. So it is not to be sensationalist when colleagues and I call for the fact that homelessness is a terminal condition. Many of the patients that we serve will pass away before their number is called to get into social housing. This was the impetus for us to launch a social medicine housing model at the University Health Network, which was able to leverage a parking lot in partnership with the federal, provincial, and municipal governments and Fred Victor as a supportive housing agency to establish Dunn House. And really appreciate that Parliamentary Secretary Desrochers was able to visit earlier this year and be able to visit with Mr. Miles and many of the staff that have been working to provide a more comprehensive model that has healthcare right on site. I am privileged to work there as a primary care physician. We have mental health and addictions and psychiatry, Indigenous health programming, and peer workers and community health workers that are all wrapped around the patient and tenant in their journey. Many of these patients have been high utilizers of the healthcare system. We know from some of the local data that in downtown Toronto, 234 patients can make up over 15,000 emergency department visits in 1 year. And the preliminary results that we've been able to see for 51 individuals who've been living at Dunn House over the last 12 months is a reduction by 79% in hospital bed days and a 62% reduction in emergency department visits. We're grateful that this has led to seeing an expansion with 54 more housing units supported by the federal government, the province of Ontario, and the city government to ensure that more people can receive these life-saving interventions and to interrupt these doom loops and really what I would argue have been deaths of indifference that have been occurring across the country. When we look at some of the other jurisdictions, again, and look across the country, there are extremely notable examples of supportive housing working, reaching people, helping people reestablish their own trajectories. But sometimes we can look at countries like Finland that have been the poster child for a progressive way of addressing homelessness. Their rates of homelessness in the 1980s were higher than what we saw in Canada, and they have been able over the last 10 to 20 years to try to eradicate homelessness. But sometimes when I reference Finland, people dismiss the example by saying it's too progressive or too socialist of a country to have as an example for us in Canada. So then I turn to another city that is in Houston, Texas, and that is in the state of the U.S. And then the last 5 to 10 years has housed 25,000 individuals. We've seen in Toronto a complete reversal in this tale of two cities where homelessness has doubled over the last 4 years. So I believe the urgency for us to act has never been more dire. We know what the solutions are, and I'd also like to commend the Crown Agency of Build Canada Homes that has been able to try to be a vehicle to see more supportive housing reach people. I believe it's an effective avenue that we need to see more investment to try to see many of the housing options reach people, as Mr. Miles spoke to, and obviously seeing, again, a cross-partisan, every level of government approach to try to end homelessness as a healthcare crisis. When we look at Houston as some of the examples that were laid out earlier today, a large part of their success was the focus, the political will across political parties to try to end homelessness, and really this removal of some of the silos and barriers in terms of trying to bring the private sector, public sector, and various community health organizations all together in one room